you have tuned in today to Rogers Television, and firstly, I'd like to say thank you to Rogers Television for offering us this studio and the time and the opportunity and the skill of our producer, director, Rye Howitt. You tuned into Health Matters. This is the Mental Wellness Changing Steps segment of Health Matters, and the show is entitled Changing Steps because change happens in little steps. We'd all like to lose 20 pounds like that, or stop feeling symptoms of anxiety so that it doesn't interfere in our day, but everything about us, we're more complex beings, and when we look at people holistically, we know that change does happen in little steps. So today, I'm going to get really excited as I'm talking with my guest, because he's, with some other folks, has started this amazing resource for people, not only across Ontario, but across Canada. And I will have him introduce himself.
I'm Dr. Zohoor. I'm one of the family docs in Brampton, Ontario. I do a day a week of psychotherapy, and about a year and a half ago, I had a patient who had PTSD. He, in fact, had done a tour in Afghanistan, and he had witnessed very traumatic events,
right,
and he had not slept more than half an hour for months on end, and he had been on many medications and nothing. He had been in many treatment centers. So I started to kind of see him for psychotherapy, and we saw each other and used various techniques over a year period. And he made some dramatic improvements. His sleep improved, he was functioning better, and he started working. And unfortunately, because of work, he had to move. So then he was traveling 2 hours to come and see me, which was really unfair, especially in a Canadian winter. So at the time, I kind of looked at options in terms of being able to see him in other ways.
Right.
And the regulations surrounding seeing patients on video or over the phone are very strict because of privacy issues, and so there was nothing really concrete that was available. And although it's something a lot of patients ask me about, can I just kind of call in and instead of coming to the clinic, or can we Skype or whatnot? Our regulatory bodies don't allow for doing that. The other issue, to be honest with you, that I face on a daily basis in clinic is that mental health resources, in terms of kind of community resources, are often limited.
Right.
And it's also inaccessible. So oftentimes people who feel overwhelmed, it's difficult for them to make appointments and go to those appointments. If they have children, getting them ready, sitting in that waiting room for 2 hours. In a small community, oftentimes people know each other, and there's a lot of stigma about kind of people don't want to be seen.
Going into the clinic or the counseling office.
Going to the counseling office.
Mm-hmm.
And then cost can often be prohibitive in the private counseling world. And the other thing I sometimes face is people sometimes come with very specialized needs. They're having gender identity issues, or they have a very very traumatic loss of some sort, and none of the psychotherapists and counselors in town may have that expertise. Have that expertise. So there's a lot of and if there's one thing where the match with your provider matters, you really want a good surgeon, but if you don't have the best conversation, it may not be as important. But when it comes to your psychotherapist and your counselor, those things really matter. So we started to look at those problems, and I with a small team, we started to develop a platform. So we've created a online video-based platform. At its core, we've kind of used military-grade encryption and security. We use servers in Toronto that the pharmaceutical industry uses, and so on. So we've really focused hard on making it as secure as we can. And as easy as we can. So there are no plugins. The sessions happen on the website. And then we started to try to kind of get as diverse set of therapists as we can across Ontario.
And that's how we met. I got an email from you, and I was like, wow, this is fantastic, because as a clinician, I also work with adoptive families that have adopted kids who have PTSD or reactive attachment disorder, and they're parenting these, kids with complex needs, but there was no one in their community that understood what they were, what they could advocate for in the school system or what supports they needed at home. So I would start Skyping, and that was and my regulatory body was okay. We're just developing policies around that. But it really, truly was the only way. And I struggled as a clinician in terms of feeling like, is this, as safe as it could be? But then it was either that or no help for that person at all. So when I got your email, I was like, this is amazing.
And I'm so happy that you're there. And it's been and every kind of therapist, psychotherapist on the platform I've chatted with when they've come on board, and the diversity of experience has been astonishing. I feel like I learn so much every time. We have clinicians who have been in practice for 40 years who have an unbelievable range of experience in multiple places. We have directors of Kids Helpline on the system. We have people from who have trained in other parts of the world, who have come to Canada and retrained and recertified, but have a lot of insight into those cultures, into South American culture, Russian culture, Middle East, Africa. So kind of because those cultural components as well are
so important
to kind of feeling understood, and there are details that just don't make sense outside of that culture. So we've been really lucky in terms of having a diverse set of experience and expertise, as well as languages and background on the system. So we have right now around 55 psychotherapists, and I am honestly blown away every time I talk to a psychotherapist on the system about kind of their background and their journey in terms of where they've gone. And so it's been, and at the moment we have done our best to keep prices as low as we can. That's
also what I would really love, I have to tell you, because if you're a viewer at home who is struggling with a mental health challenge, and maybe those challenges have impacted their ability to secure employment or to work as regularly as they want to work, they may need psychotherapy desperately but just can't afford it. So your prices are a lot lower than what it would be if you went to someone's office. But if I also have 2 little kids at home and I have to go to an appointment in between nap time, like it's just not possible.
Yeah, and it's been and that is really helpful. Even people who have insurance oftentimes have very limited for number of sessions, and as we both know, in reality, a couple sessions you really only begin to really get a feel for the situation, and it's often not enough for actual treatment. On that vein, the next several months, and in fact, by the time this airs, perhaps, we plan to start a charity arm and start to fundraise and have options for people where that price point is still too high, and try to provide a lot more options. We're teaming up with some of the psychotherapy schools in Toronto where they're supervised, and there's a supervisor who's attached who monitors all the sessions.
That's wonderful.
So they often are very motivated. They often are themselves are really fantastic.
Because they want to help.
Exactly.
We want to help people. So if I'm an audience member at home and I go to Inkblot Therapy and I register as a client, what would I expect to see? What are you going to ask of me?
So initially, we ask whether you have any specific kind of areas of difficulty, and whether it's, let's say, an eating disorder or gender identity issue, and so on. If they have any language or background, as well. The other thing is religion. Some people, a lot of their coping comes from their religious beliefs, and
so they need someone who understands the
exactly.
the intricate issues.
And we have rabbis, and we have people who have very, from various religions who have very specialized knowledge set from that. And then, if that's their preference or not, then we do a bit of a psychological profile to get a sense of where their needs are, whether they, it's an interpersonal component of socializing, whether it's feeling or if it's a psychological component with a lot of rumination. And then we match them with several counselors on the system based on those factors.
So they get a choice.
They get about 6 counselors
That's wonderful.
to choose from, and reading the profile, looking at availability, and then booking those sessions. The first session is free. just to make sure that they feel it's a comfortable match. And also, I think a lot of people have anxiety surrounding it. The reality is, once you're in a session, the screen just disappears. It's amazing how the conversation just carries the moment. And then they can book further sessions after that. So we've tried to kind of mimic what happens in real life and keep it simple, and at the same time really allow for accessibility of having mental health providers across the province accessible to you who have various needs, with people who specialize in with veterans and with the military. We have so all sorts of things that kind of come up.
So I can pick my therapist. I can pick the time I want to see my therapist. Yeah. I can pick the values and aspects of my life, not just the challenge that I have, but if faith is a big part of my life, I can have someone who totally understands that, and then try it out and see if it fits.
And see if it fits. And
so wonderful.
Because sometimes, you know, you think it's going to work, and that first session and what often happens is people contact us, and the feedback has been tremendous. It's been fantastic from healthcare providers, from family physicians who
now can refer their clients.
Exactly. So to them, it's been excellent. And then I find the psychotherapists have been because most of them haven't done this before in terms of video. So for them, it's also So for them, it's also they've loved it. Because they can also work in surrounding in the evenings and so on.
I know I had a session with a family, and what they were bringing forward, I was like, I'm not sure you need some information. So here's the information, and if you want to come back, come back. But it wasn't like now you're roped into these many sessions. It was, you're doing a really great job, you're on point, you could do this or this, and come back if you. And they felt kind of happy, and I was like, I felt so, it was really wonderful as a clinician to be able to know that they could get that support from their living room at 10 o'clock at night. Yeah. So we are at an end. It's hard to believe the time goes by so quickly. Please look at the bottom of your screen for the connection for inkblottherapy.com. I was so happy to get the email. It was so wonderful to talk with you and meet with you. To see that you're up and going, and I predict that this program is going to meet the needs of so many people that prior to this were really isolated, and across Canada. So thank you.
Thank you so much for the invite.